the best kind of study, randomized, placebo-controlled, prospective, double-blind. I asked AI, how much do you think this study cost? Novo is who makes semaglutide. And AI said between $30 and $100 million. Oral semaglutide in the SOUL trial. Cardiology just published the secondary analysis of heart outcomes, basically showing that oral semaglutide in patients with type 2 diabetes who either had heart disease or kidney disease had improved outcomes with oral semaglutide over 4 years of follow-up. There's a couple of things I think that are really interesting and important takeaways from that. They started seeing improvements at, I think it was 13 weeks, early on, even before significant weight loss. Is the cardiac benefit independent of weight loss, or at least partially independent of weight loss? Second important takeaway is that this was a massive study. This was in over 9,000 patients in 33 countries, and I think like 444 sites for 4 years, because it was an outcome study. So that means you have to wait until there's the heart attack or the stroke, the outcome to happen. This is a major study. So I think it's really important to look at adverse events in these studies. So you can get to adverse events on the New England Journal of Medicine by clicking the supplementary data and then reading all the adverse events. Most of the things, no significant difference between the two as far as adverse events. There was more discontinuation of the medicine that was statistically significant with because of GI side effects with the medication. There was no increase in pancreatitis over 4 years with this medication. There's actually some gallstone disease with this medication. I'm guessing that's because rapid weight loss. They looked at retinal disease, and there was no significant increase. And they looked at vision issues. NaION would come in under vision issues, blindness. In this study with oral semaglutide, remember semaglutide is the one that has kind of been reported maybe to have more of these NaION or blindness events. They reported no increased vision events in this 4-year study. So that was reassuring, especially because, this is a high-risk group. No increased malignancies, no decreased malignancies either. These medicines obviously are not for everyone, but I think it's reassuring to the people who need them to hear these facts. Of course, all medicines have side effects, and you always have to weigh the risk versus the benefit, but this is what that study showed. Let me know what your thoughts or questions are below.